When your knees start to ache and walking becomes harder, most people think, I guess I'm just getting old. But did you know that pain might not be just because of aging? It's true that joint pain naturally increases with age, but if we don't fully understand the cause, even the best supplements might not help at all. That's why many people turn to supplements like glucosamine and chondroitin. They're known to help with joint health. Pharmacies, TV shopping, and online stores are full of products containing these ingredients. But here's the problem. Some people feel better after taking them, while others notice no change, even after months. Why does this happen?
As an orthopedic doctor, I've heard this question countless times from my patients.
In today's video, I'll explain the true science-backed effects of glucosamine and chondroitin, and who actually benefits from them, and when it's just a waste of time and money. We won't just talk about the ingredients, I'll also share real research and smart strategies for taking them.
Within our joints lies a soft tissue called cartilage, which acts as a cushion so bones don't grind against each other. Glucosamine and chondroitin are components of that cartilage, and the idea emerged that giving the body more of those ingredients might protect or even rebuild cartilage. Glucosamine is an amino sugar that serves as a building block for glycosaminoglycans in cartilage. Chondroitin is one of those glycosaminoglycans. It attracts water and helps maintain cartilage elasticity. To put it simply, glucosamine provides the bricks for cartilage, while chondroitin works like the mortar, filling gaps to support the structure. But adding materials doesn't guarantee full repair. They work as supporting ingredients under specific conditions. Research on the effectiveness of glucosamine and chondroitin has produced mixed results. Some studies report clear benefits, while others see no significant change at all. This can naturally lead to confusion. Looking closely, studies that showed positive outcomes usually involved long-term use or participants with early-stage osteoarthritis. For example, the 2006 GATE study by the US NIH tested glucosamine and chondroitin separately and together. In patients with more severe knee pain, a meaningful reduction in pain was observed. On the other hand, studies that found no benefit often involved short trial periods or patients with already severely damaged cartilage. Also, the quality and dosage of supplements varied widely across studies, making consistent results difficult. So the truth is, these compounds aren't miracle cures, but they aren't useless either. Their effectiveness depends on who takes them, when, how much, and in what form.
To understand why some people benefit from glucosamine and chondroitin, while others don't, let's dig deeper. First, absorption. These compounds must be absorbed in the stomach and travel through the bloodstream to reach the joints. As we age, digestive function often weakens, which can reduce absorption. Some individuals may also have a genetic tendency to poorly absorb these substances. Second, companion nutrients. Vitamins like C and minerals like manganese may enhance the effectiveness of glucosamine when taken together. However, certain medications, such as anti-inflammatory drugs or antacids, may interfere with their function. Third, timing and duration. These are not painkillers, so the effects aren't immediate. Typically, a minimum of 2 to 3 months of daily use is needed to notice subtle changes, and more meaningful improvements may take 6 months or longer. Lastly, the remaining cartilage matters. If the cartilage is already worn away to a severe degree, even the best supplements will have limited effect. That's why doctors often use X-rays or MRIs to assess the state of your joints before recommending treatment. In short, the benefits of glucosamine and chondroitin can vary widely depending on your body condition and how you take them.
So who benefits the most from glucosamine and chondroitin? The answer is clearer than you might think. First, those in the early stages of knee osteoarthritis. At this stage, cartilage is still present, making it possible to protect and slow further damage. If your X-ray shows that joint space still exists, or if you only feel pain during movement, supplements may be worth considering. Second, people who feel discomfort during daily activities, like bending the knee or walking for a long time. If stairs cause discomfort or your knee makes popping sounds, you fall into this category. Third, those hoping to delay surgery. If you've been diagnosed but want to postpone surgical intervention, these supplements might help maintain joint function in the meantime. However, always consult with your doctor before combining treatments. Also, individuals who are sensitive to medication side effects or want a safer long-term option may benefit. Glucosamine and chondroitin are generally safe and well tolerated, even for those with high blood pressure or diabetes. In summary, these supplements are most effective for people who are still in the early stages of joint degeneration and are actively trying to manage the condition before it worsens.
Let's now talk about the first step in your supplement strategy, how to choose the right product. First, check the purity and dosage. Glucosamine typically comes in two forms, glucosamine sulfate and glucosamine hydrochloride, or HCl. Studies show glucosamine sulfate tends to be more effective. You should look for products containing at least 1,500 milligrams of glucosamine and 800 to 1,200 milligrams of chondroitin per daily dose. Second, consider additional ingredients. Some products include MSM, an anti-inflammatory, hyaluronic acid, or vitamin D. While these can be beneficial, too many ingredients may dilute the key ones, reducing their overall effectiveness. Stick to products that focus on the core ingredients. Third, pay attention to the form. Tablets, capsules, liquids, and powders are all available. For those with sensitive stomachs, liquid or powder forms that dissolve and absorb more easily may be better. Also, trust the manufacturer. Choose products from companies with GMP certification or published clinical studies to ensure quality and safety. Lastly, don't base your decision on price alone. Cheaper options may use low-quality ingredients, while expensive ones aren't always better. The most important habit is reading the ingredient label carefully. Once you've chosen the right product, how you take it becomes just as important. This is the second key step in your supplement strategy. Let's start with the daily dosage. The recommended amounts are 1,500 milligrams of glucosamine and 800 to 1,200 milligrams of chondroitin per day. You can take it all at once or divide it into 2 or 3 doses. If your stomach is sensitive, splitting the dose may be better. Timing also matters. Taking supplements right after a meal improves absorption and reduces stomach discomfort. Some studies suggest lunch or dinner may be more effective than breakfast, but it depends on your digestive condition. As for duration, consistency is crucial. These aren't painkillers. You won't feel immediate relief. Many people stop too early thinking it doesn't work, but studies show meaningful results usually appear after at least 3 to 6 months. Another important tip: consider cycling. Some research suggests taking the supplement for 6 months, then pausing for 2 to 3 months before resuming may be more effective. Flexibility based on your joint condition is key.
Now we come to the third step in your supplement strategy: which nutrients enhance the effects of glucosamine and chondroitin, and which combinations to avoid. Knowing this can significantly boost your results. Let's start with helpful combinations. Vitamin C supports collagen production, which benefits cartilage health. Taking it with glucosamine may support cartilage repair. MSM, a sulfur compound, has anti-inflammatory effects, reducing joint pain. Vitamin D strengthens bones, easing pressure on joints. And omega-3 fatty acids help lower inflammation, creating synergy when taken with joint supplements. But what should you avoid? One major issue is mixing these supplements with certain medications. NSAIDs, or non-steroidal anti-inflammatory drugs, and antacids can reduce glucosamine absorption. If you're on diabetes medication, be careful. Glucosamine may affect blood sugar levels. Always consult your doctor in such cases. Also, avoid taking too many supplements at once. Excessive combinations can cause nutrient interactions, diminishing effectiveness or triggering side effects. In short, while glucosamine and chondroitin can work well alone, pairing them with the right nutrients enhances results, and the wrong combinations may cancel their benefits.
If you feel no benefit, check 4 things. 1. Were you taking the correct dosage? 2. Did you take it consistently for at least 3 months? 3. Could other medications or foods be interfering with absorption? 4. Is your cartilage already severely damaged? If all 4 boxes are checked and still no effect, it may simply be individual body differences. In that case, exploring other supplements or treatments may be the wiser choice. Let's wrap up what we've learned today. Glucosamine and chondroitin are key components of cartilage. They may help slow the progression of knee osteoarthritis and relieve pain, but results vary widely depending on the person and how they are taken. Here's a step-by-step guide. First, start by reading the supplement label carefully. Look for at least 1,500 milligrams of glucosamine and 800 to 1,200 milligrams of chondroitin per day. Second, commit to taking it consistently for at least 3 months. Consistency is the key. Third, consider adding supporting nutrients like vitamin C, vitamin D, and omega-3s to enhance effectiveness. Fourth, if pain worsens or no improvement is seen, consult your doctor about alternative treatments. If you're hesitant about whether these supplements are right for you, that's completely natural. Don't give up. Start small. Even trying one product for 3 months can be a meaningful step. I've had patients who doubted at first, but after 6 months, reported less pain when climbing stairs. Not everyone sees the same results, but improvement is certainly possible. I hope this video serves as a guide to better joint health. I'll continue sharing reliable medical insights to help improve your quality of life. If you found this video useful, please subscribe, give it a like, and share it with family or friends struggling with knee pain. For them, this information could bring real hope.